Hello and welcome to episode 55 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is why you should stop doing yoga for back pain. Yep. Oh my gosh. I just got a bunch of people in a tizzy, but listen through to the end. I promise. If you missed last episode, we discussed a unique and delicate topic related to erectile dysfunction, testicular pain, painful urination, painful erection, and even painful orgasm, and how that could be caused by your low back disc and sciatic issue. And I talked through how this is quite common in a lot of men in a test sequence that you can go through that is located on my private Facebook page. So if you haven't joined that Facebook page, it is called RehabFix Low Back Program. Go join, answer the questions that you are prompted at the start so that you can get in there and you can discuss things one-on-one with me. I'm answering all questions privately in there and posting additional information. But to get to today's topic, which is yoga and low back pain. Oh my gosh, I'm going to get some comments from this one. So listen all the way through. Don't have your mind made up yet. So let me discuss why I'm bringing this up. I'm bringing this up because probably 80% of my clients have listed that amongst all the things that they have tried yoga. And probably out of 80% of those people who say they've tried yoga, probably 60% of them say it made them worse. Okay, probably more, probably 60 to 70% said it made them worse. Now, so many people who are into yoga right now are saying, what? Oh my gosh, no way. Why would you say this? Yoga is amazing for everybody. Everyone in the world should be doing yoga. And I'm sorry to say it's not true. It's not true. And I'll explain why. Nobody in the world should be doing anything that is a guess or is, new territory for them with a particular serious condition, okay? That's like saying, oh, everybody in the world should be doing CrossFit. And a lot of people believe that. Okay, let's go ask 60-year-old Susie, who's 50 pounds overweight, who hasn't moved in 20 years to go jump in a CrossFit class. It's not right for her, okay? Not right. The same thing goes for people with low back pain. It's not right for everybody with low back pain either in regards to yoga. So let's understand this. I really want to make this clear, okay? Yoga can be great for the right person. Yoga can be awful for the wrong person. Why is that? Grant, I thought you encourage movement. I thought you say movement is good, movement is medicine, and all that stuff. Yes, for most people, yoga is encouraging movement, encouraging mobility, encouraging mindfulness. It's great. It's great for most people. But most people who immediately turn to yoga for like a specific reason is because they just started getting low back pain. And they immediately go to yoga, and a lot of times it makes them worse. And the reason why is because movement is medicine. You might be thinking, yeah, movement's medicine, so why wouldn't they move? No, movement is medicine, okay? Every different movement you do is the equivalent of a different medication, a different pill. If I have a gut issue, I want to take the right supplement for that gut issue. Now, what if instead I went, you know what? I'm going to go buy 20 different supplements. I'm going to go buy 20 different medications, 20 different drugs, and I'm just going to take all 20 at once. I'm just going to take 20 pills, hope one of them helps. Well, I bet a couple of them will help. I bet a couple of them will do nothing. I bet a couple of them will hurt and set you back. Okay? The same thing goes for movement, the exact same thing. Many low back issues that are persistent, that are not going away, that you're experiencing like disc issues or symptoms down the leg. You notice the longer you sit, the harder it is to stand up straight. You feel locked. Bending over to put on your socks and shoes first thing in the morning is tough. There are going to be movements that are your friend, and there's going to be movements that are your enemy. At least at this point in time, we are using the context of someone with an acute, sensitive low back issue or chronic sensitive low back issue, okay? Certain movements will be your friend. Certain movements will be your enemy. What is yoga? Yoga is a compilation of many different types of movements. In one movement, your spine could be twisting. In one movement, your spine could be bending forward, another bending back, another leaning to the side, another leaning to the other side, another your hips in this position, hips in that position, staggered, wide, narrow, right? There's so many different movements of your low back and your hips in yoga. So it's just like, you're like, oh man, I got to go take a pill for this headache. And you take 20 different pills. You take 20 different random pills, hoping one of them is going to help. That's the same thing you're doing with yoga. So a lot of people with the symptoms I just described, low back pain, disc herniation sciatica, sitting long periods, doesn't feel good. Bending over first thing in the morning, doesn't feel good. One hamstring tighter than the other. Symptoms on the leg. They'll go in there and they'll be doing some forward folds or some downward dogs or maybe even some cobras that they're not ready for yet. And they will leave that yoga practice flared up. This is not because I'm saying yoga is bad, okay? I'm not saying yoga is bad. I'm saying yoga is a combination of many different movements. And someone with a sensitive low back, there's going to be certain movements that are going to be helpful and certain movements that are going to be harmful. And unfortunately, the harmful ones usually stand out more, okay? They're going to flare that person up. And then they're going to leave that yoga thinking, well, yoga's bad. I don't like yoga. And I don't want yoga to have that rap, right? But I also don't want yoga to be looked at as a cure for a sensitive low back issue. You need professional guidance. If you're doing a yoga practice, you're guessing on what movements are going to help. Now, maybe you're that unique individual who gets lucky. You might get lucky. You might go into yoga and do it for a few weeks and notice your back pain is getting better and better and better. That's great. All right, good for you. But for the person who's going in there and is getting flared up every single time, but they keep going because the internet is telling them, or the yoga teachers are telling them, or their friends are telling them, you should do yoga. You should do yoga. Yoga is amazing. Stop doing it. If it's flaring you up, stop doing it. And I want you to understand how yoga is a combination of 20 different movements, 30 different movements, 40 different movements. Just like if you're taking 20, 30, or 40 different pills for one particular issue, you know that would not be effective. So don't do that with your body. Movement is medicine, and movement needs to be respected as medicine. Don't guess what's going to help you. Don't guess what's going to hurt you. Consult someone for actual help. Okay? I'm not a lawyer. I'm not going to pretend to be. I'm not a neurosurgeon. I'm not going to pretend to be. Okay? I don't work in HVAC. I'm not going to try to go fix my HVAC system. I don't know that stuff. Okay? You're not a low back expert. Don't pretend to be. Don't pretend to be your own doctor. Okay? Now, I put out as much information as possible to try to educate you, to try to teach you about movement, to try to teach you good habits. And that can help so many people. I get messages all the time from people who were able to fix themselves just with my free content, and that's great. But if you are in a serious situation, then you need a serious approach. If this is significantly impacting your life, don't guess. If this is affecting your career, affecting your family, affecting your relationships, affecting your quality of living, don't just try to be your own expert and guess. Do it right the first time. Don't screw anything up more. Do it right. Consult help. Let me and my team help you. Okay, get it right from the start. So you're not wasting time, you're not wasting money, and you can get to the solution as quickly as possible. All right, so I'm not anti-yoga. I'm not pro-yoga either for sensitive low back issues. I am pro strategic structured plan to very rapidly improve your symptoms so then you can get back to yoga. You could get back to hiking. You could get back to spin class. You can get back to doing whatever you want to do, okay? I would love to see you back in yoga. But if it's flaring you up every time, it's because you're doing 50 different movements. It's like you're taking 50 different pills. Some of them are making you worse. Don't just keep doing that expecting something to change, okay? Movement is good. If you feel fine doing yoga, then keep doing it. I'm not saying it's going to make you worse. I'm not saying anything like that. Don't hear what I'm not saying, okay? But if you fit any of the category that I discussed today, you need help, and you know that you need help. You need to invest in help. You need to invest in your body. So let me and my team help you submit an application on my website so that we can be a team throughout this process and get you to that solution as quickly as possible and put the plan in place for you so you can see results live during the call and see significant improvements within the first week. If you or someone you know has been struggling with yoga in particular, share this podcast with them. I would love to help them as well. If you are listening on your favorite podcast platform, please leave a 5-star rating and review. It does help the podcast grow. That's a free, zero-cost way to help me. If you're watching on YouTube, please like, comment, and subscribe. Don't forget to join my free Facebook group, which is called RehabFix Low Back Program, where I post additional content and will interact one-on-one with you, and you get to ask me my team questions. As always, move more, move in nature, move in the sun. Thank you so much for listening, and have a great day.